Good morning, everybody. It is Friday, 4th of July weekend. Hope you're having a great summer so far. Finally quit raining here in Missouri. So if you ever look in the mirror and wonder what's going on with your face, it's the class for you. We're basically talking about hormones, but there's a whole bunch of things that you can figure out from looking at yourself in the mirror. Uh, Not to be critical of your face, but if there's certain changes that you're noticing, they may be hormonal, and this is true for men as well. There's cardiovascular signs. There's by looking at your face. And so, really, what can your face tell you about hormone balance? Well, actually, a fair amount. So, if you know what to look for, uh, you look in the mirror and you can find signs of hormone imbalance if you, in fact, have hormone imbalance. So, starting at the top, if you're losing hair at the crown of your head, so men do this. Mine is kind of that way if you look behind me, which you can't. Um, but sometimes that's a thyroid problem, a thyroid deficiency. Women tend to lose hair from lack of testosterone, which, once you're menopausal, ovarian production of hormones drops significantly. And in the case of 17 beta estradiol, from hormone conversion, usually from DHEA. But thyroid hormone affects the thickness of a hair shaft as well as the abundance of hair. And 50% of women over 40 have a thyroid imbalance or a thyroid dysfunction. Men, not so much. Men usually lose hair from familial genetics. Sometimes you can reverse hair loss in men. You can almost always reverse hair loss in women, either with balancing hormones or with platelet-rich plasma facials, the vampire facial, where you're using your own platelets to help re-stimulate the hair follicle. It's alive, it's just not active. So adequate amounts of sex hormones such as estrogens and testosterone also contribute to the luster of your hair. And then your diet can play a role. So your hair might need more minerals, might need more proteins. So if you have insufficient intake of those nutrients, it can contribute to hair problems. As well, low stomach acid prevents absorption of minerals and proteins in the stomach. So you start breaking down starch and fat in your mouth, and then all of that stops with a low pH of 2 in your stomach. So the only thing that's really absorbed directly from your stomach is non-steroidal anti-inflammatory drugs like Aleve, naproxen, aspirin, and alcohol. That's the only two things absorbed directly into your bloodstream through your stomach lining cells. Okay, so you you also need digestive enzymes to break down proteins, and they make pancreatic digestive enzyme supplements that can help improve your digestion uh, and absorption of proteins in your diet. So let's look at your eyebrows. If they're thinning or if you've lost the outer third of your eyebrow, that is the sign of hair togue. If I said that right, that's my Missouri lingo. And that is the endocrinologist who first made the observation, and it's typically a sign of a low thyroid function. And remember, we did a whole class on thyroid. If you're just having a TSH screening for thyroid dysfunction, that will not tell you enough. You need the full thyroid 7 panel. So TSH, free and total T3 and T4 and reverse T3, as well as checking for thyroid antibodies and thyroid peroxidase antibodies. If your eyelids are drooping, lots of people go to plastic surgeons and have excess tissue removed uh, from their eyelids. But growth hormone deficiency can contribute to the loss of elasticity, especially around the eyelids. Growth hormone releasing hormone, sermorelin and ipamorelin and various others, is an easy way to maximize and optimize your growth hormone levels as we age. So growth hormone is significantly optimum, like in the highest range, usually in your teens and 20s, and starts falling like most hormones with age. So there's a safe way to optimize your growth hormone levels using releasing hormones. Little shots, kind of like insulin shots. They don't hurt, they're easy. Um, and they will optimize your growth hormone levels safely with no chance of overdosing and getting too much growth hormone. Okay? If your eyes are drooping as well as growth hormone, um, that may be related to cortisol deficiency, which we don't see that often. Usually people have stress and anxiety leading to cortisol overload, pretty much. But cortisol can lead to droopiness of eyes. And then if your eyes are dry or they're watering, you may be unable to build the fatty layer of your tears. And so proper production of tears is influenced by testosterone, DHEA, progesterone, and the estrogen hormones. So all of those are at, hi Linda, all of those are at work just on your eyes, just for tear production. Okay? Eyelashes, kind of a big deal. It's a point of beauty in this society. So thyroid dysfunction and thyroid imbalance can lead to loss of eyelashes. And then sex hormone deficits associated with aging can also contribute to losing eyelashes, and is second only to allergies as a cause of eyelash loss. So hormones are a big deal for eyelashes. And then having allergies is also, so seasonal allergies can be an indicator of low adrenal hormones, such as the cortisones. So you may not see it in your face, but if you feel nasal stuffiness, that can be associated with the ebb and flow of hormones. So when estrogens peak at mid-cycle, you may find that estradiol peak. And then if you're also plagued with an itching nose, or you develop a habit of rubbing your nose in an upward fashion, you can actually get a horizontal crease in your nose, which alters your looks, of course. Okay, let's move down to the upper lip. There is a condition called melasma. You can see it in the mask of pregnancy. That's the most common thing people think about with melasma. So it's a hyperpigmentation of the skin associated with hormone disturbances and associated with pregnancy and birth control pill use. So sun exposure may trigger melasma or make it worse. The underlying hormone responsible for melasma is melanocyte stimulating hormone, which increases the production of melanin and is responsible for the darkening of the skin. So the upper lip is a frequent location, but you may also find dark spots in other areas as well, sometimes known as age spots or sun spots or liver spots. And then increased areas of darkened skin can actually be related to adrenal dysfunction or adrenal fatigue. Most doctors don't believe in that diagnosis. There's a guy that coined the term, Dr. Wilson, I believe is his name, and he coined the term adrenal fatigue. So look up the symptoms of adrenal fatigue. You might find yourself. So as you become stressed, your body produces more and more cortisol. We talked about that earlier to cope with the stress. And as more cortisol is produced, the precursor hormones like progesterone and pregnenolone and DHEA are depleted, leaving the estrogens in an unbalanced situation. And that's called estrogen dominance. Very common in women as they get less fertile in their 40s. So estrogen dominance leads to a plethora of gynecologic problems. And the extra estrogen or estrogen dominance can actually increase melanocyte stimulating hormone, which then increases the amount of melanin deposited. So reestablishing hormone balance and then relieving stress can help prevent this and may actually reverse it. And then do you have vertical lines and wrinkles perpendicular to your lips? So those can be from estrogen deficiency as well as testosterone deficiency, both of which are true in menopause. You do get estrogen or testosterone deficiency, and then perimenopause, women in their 40s that get imbalanced estrogen, progesterone, testosterone levels. Dry or cracked lips, frequently seen in menopause. And so you lose some volume as you get older, so women don't have those full luscious lips, and thus we have Juvederm and other fillers for that. And so applying lipstick may actually exacerbate and then, well, not exacerbate, but emphasize the cracks in lips and in the lip tissue. So you can treat against the effectiveness of progesterone. And of course, we know that vitamin D deficiency is an epidemic in North America and probably really worldwide. Okay, what about chin hairs? The most frequent thing that you hear from menopausal women. You can tweeze them, you can shave, you can wax, you can use lasers, you can use electrolysis. But what's the deal? So in general, as women get older, the androgen hormones start to predominate, specifically testosterone, dihydrotestosterone, the active one, and then androstenedione. So once again, an imbalance with an uptick in the balance of testosterone, as opposed to the uptick in estradiol in women prior to menopause with an estrogen progesterone imbalance. So this one is a testosterone and its metabolites imbalance. So they all become depleted. And then if you happen to have polycystic ovarian syndrome, chin hair, and actually hirsutism overall is kind of a problem. So weight gain, younger women tend not to menstruate as often, they get irregular menses, and they get furry. So the chin hairs that develop in polycystic ovary are similar to the hairs on your head as opposed to the soft downy hair that you see associated with femininity. And so the solution is to look carefully at hormone balance. So progesterone deficit, so polycystic ovarian syndrome women do not always ovulate, and you produce progesterone from the ovary after ovulation. So they tend to be progesterone deficient. So as estrogen levels decline, there's also a loss of the carrier sex hormone binding globulin, which means that more of the testosterone-like hormones are unbound and are actually more active. So restoring estrogen may help. Some synthetic drug options include blocking receptor sites for testosterone-like hormones. The easiest one, believe it or not, is spironolactone, which is a diuretic. And cimetidine, I can't remember what cimetidine's trade name was for stomach acid, actually blocks testosterone at the hair follicle. Okay, so let's keep going about things on your face that talk about or tell you about hormone imbalance. Okay, so also along chin hair growth is dietary problems. And so dysregulation of insulin and glucose, which is rampant. Over 120 million people in the United States have insulin resistance or insulin dysregulation problems, starting with metabolic syndrome and insulin resistance. Okay, so some people have reported gluten-free diets reduce facial gluten allergy, about 1% really. But gluten intolerance, I think, is about 20% of the population. Okay, what about skin tags? Little growths of excess skin found in the neck area, sometimes on the eyelids. They're considered to be related to glucose and insulin hormone imbalances. They're prevalent in metabolic syndrome, prediabetes, insulin resistance, diabetes, and polycystic ovary syndrome. They're painless. You can remove them fairly simple. They have little kits at the pharmacy, or if you can handle it, you can put alcohol on either tweezers or fingernail clippers, and they'll come right off. And if there's a little bit of bleeding, you put alcohol swab and some pressure, and that bleeding, assuming your platelet count's normal, is going to go away. But if you do not address the hormone imbalances, you're probably going to keep getting skin tags. Okay, there may be deposition of fat around the neck, so double chin or a moon face appearance. That's also linked to glucose and cortisol imbalances and diminished thyroid function. So the neck can be flabby or have lines of extra skin. So you can work on that with neck exercises. There's such a thing. Yoga, and then surgery. There's the life lift that a lot of women have to get rid of that double chin and the wrinkly skin at the neck. But the changes become apparent when there's losses in hormones and hormone balance. So progesterone, pregnenolone, and DHEA imbalance can lead to that fat deposition in the chin. Okay, what about your facial skin tone? So if your skin is pale, you may need some thyroid work. So thyroid hormone ensures blood circulation to the skin, and when it's compromised, pallor. So you lose some of the skin tone and skin color. Instead of having a rosy face, you have a pale white face. What about cheeks if they're sagging? So androgenic hormones like DHEA, testosterone, dihydrotestosterone, and then growth hormone may be deficient, leading to cheek sagging. And then, of course, there's dehydration. So if you're dehydrated, your skin can become shrunken and then shriveled. If it's dry, it may be that you're just not drinking enough water. So it's 80 fluid ounces a day. I saw a lady, gosh, 2 or 3 years ago. She decided to just drink her 80 ounces of water a day, and she took a picture of her face every day. She was in her mid-40s. At the end of 30 days, she looked 10 years younger in her face. She was taking pictures of her face. Okay, and it may be that you're not using enough natural whole salt. So that stuff you buy with the little girl in the umbrella, that's not real whole salt. So Himalayan pink salt or sea salt is kind of a better salt. There's the white salt that you get in that little blue thing has been refined and processed and stripped of a lot of its minerals. Okay, so whole salt allows your body to hold water inside of the cells. That's one of the points of salt. And there's a hormone connection. If you're not getting enough salt and water, the adrenal glands actually suffer and eventually become exhausted, and that's adrenal fatigue. So the hormones affected with adrenal fatigue, DHEA, progesterone, cortisol, aldosterone, which has to do with water balance, the estrogens, pregnenolone, and testosterone, and then adequate thyroid function. And your face is a reflection of hormone issues that affect your entire body. Remember, hormones direct your body's mechanisms. They don't do anything, they direct. So take notice of your face, what you see in the mirror. Pay attention. Work with a functional medicine person. Work with a functional medicine health coach, functional medicine doctor. Get your hormones tested. Figure out what's out of balance and put them back in balance. So what can you do over the counter without doing prescription stuff? Well, DHEA. Still over the counter. It converts to estrogen, progesterone, and testosterone. I'm not sure why DHEA is an over-the-counter hormone, but it is. And then it goes down like all of them. So it's an age-related level. The idea is to get your DHEA-S, the sulfated level, back to the level of when you were about 30, let's say. I usually try to look at what hormones would be like at age 30 and how do you get them back to that level. That's still not overdone. It's just the level of a 30-year-old youthful person. So it's released from the adrenal glands as a precursor to the androgens and estrogens. but it may have its own effect on the body by itself. So a plethora of benefits has been associated with DHEA, from immune system support and then improved sexual satisfaction. So it's an easy sort of over-the-counter, well, easy sort of, I should say, figuring out the right dose takes some lab values. But it is over-the-counter for people that are losing their sex drive. And some people call DHEA a super hormone or an anti-aging panacea. Okay, so we're going to look at skin treatments specifically just with DHEA. So lots and lots of skin health supported by a number of studies, including both systemic or total body and then localized treatment methods. So you can get DHEA as a cream, you can get it as a gel. There was a study in 2000 on 280 men and women aged 60 to 79 who were given 50 milligrams of DHEA by mouth daily for 1 year. The outcomes were evaluated, and with regard to skin specifically, 50 milligrams of DHEA for a year improved sebum production, skin surface hydration, skin pigmentation, and then epidermal thickness. So, if the kind of paper thin cheeks that your grandma has can be reversed. DHEA, simple. No harmful consequences for 50 milligrams per day dose. Most men take 100 milligrams, if not 200 milligrams a day. Women, 25 to 50 milligrams. I have a gynecologist friend in Florida that thinks the highest oral dose of DHEA that women should take, I think, is 10 or 12.5 milligrams, and then she goes to a DHEA cream. Quite a bit more expensive, like $6 a month versus $89 for a transdermal DHEA compounded cream. And so if you have too much DHEA, you get androgenic side effects. So that's the importance of labs. So you can get excessively oily skin, but oil of Olay, when you ask women who have really pretty skin as they get older, every one of them tells me they use oil of Olay. I've heard that for 30 some years. And then you can get acne, you can get increased facial or body hair. You can get some breast tenderness because of the estrogen conversion. So that's the importance of checking labs and making sure that you're not getting a ridiculously high amount of DHEA into your body, especially if you're taking it systemically. And then another study went the topical route. So a more direct approach with a lower dose of DHEA. And over the course of 4 months, 20 postmenopausal women applied DHEA 1%, that's 10 milligrams per gram cream to the skin on their face and hands. And then they were compared to a placebo group with no active ingredient in their cream, and found that topical DHEA tended to improve skin brightness and to counteract epidermal atrophy, so loss of skin volume, as well as the papery appearance of aging skin. So DHEA cream 1% to the face and hands. Those are the two skin areas that most women look at specifically. Men, not so much, but sometimes. Okay, what about DHEA in the vaginal tissue? So vaginal atrophy, I talked about this yesterday. The treatments for vaginal atrophy, which is dryness, itching, irritation, burning the vagina and the vulva, painful intercourse. It's an estrogen deficiency problem. So it's usually treated with estradiol estradiol pellets, which used to be known as Vagifem, and then Premarin cream. Vagifem, generic, is $10 per pellet. So you use them 3 times a week. So a book of 8 is like $78, $80. Premarin cream has gone to $400 for a tube. And so DHEA is one of the ways that you can do that, placed vaginally and then on the vulva. And then there's estriol cream that needs to be compounded. That runs about $40 for 90-day supply. So the traditional treatments for vaginal atrophy is usually lubricants. The best one is Astroglide, and moisturizers and vaginal estrogens. But DHEA has been shown to improve symptoms of atrophy. So a 12-week study, 500 women, 6.5 milligrams of DHEA administered vaginally. So you can use DHEA in a compounded capsule or in a cream or gel. And this study resulted in the following benefits to vaginal health. So improvements in vaginal pH. And if your vaginal pH is off, meaning it's higher than 5, you will get bacterial overgrowth, and you might get bacterial vaginosis with that fishy odor that everybody makes jokes about. Vaginas don't have an odor. If they do have an odor, something's wrong. And then there's improvement in skin thickness, so that epithelial layers, it's not a simple layer in the vagina. There's layers of tissue in the vagina, which, if there's atrophic changes, the vagina becomes pale. It's almost white, creamy colored instead of pink. And then the vaginal rugae, the little nooks and crannies in the vagina, flatten out, and those are sometimes gone completely. Okay, you can get increased vaginal secretions with DHEA, and that's what you want. So you want the vagina to actually secrete moisture into it to keep from getting dried out. And then you get reduction in pain from sexual activity. That is a common problem for women in menopause. They will say, I don't want to have sex because it feels like I'm having sex with sandpaper. It's very uncomfortable. And then so the vaginal dryness tends to get better. Okay, and on that study, all the DHEA blood levels remained well within normal postmenopausal values, so that they weren't even setting it back to the age of about a 30-year-old. So that's a little quick primer on looking at your face and what it can tell you about hormone balance. There's a whole bunch of stuff we could talk about on faces, and maybe I'll do one a week, depending on what system, because it would take too long to do the entire thing. So have a great weekend. I'll see you Monday, and have a great 4th and stay safe. Talk to you later. Bye.